Here we'll talk about Paget's disease of bone, which is also called as osteitis deformans. Before we get into the topic, the word osteoclast has C in it. So the C stands for cutting the bone or the bone resorption. In the word osteoblast, the B stands for building the bone or the bone formation. In the beside picture, you can see the osteoclastic activity where the bone is destroyed, or osteoblastic activity where the new bone is formed. So what happens in the Paget's disease? There will be mixture of both resorption and the new bone formation, but the new bone which is formed will be disorganized. So this causes the bone to be weak and fragile and susceptible to fractures. So the patient comes to you with the disoriented legs and with a history of frequent fractures. Etiology: this is caused because of the increased destruction of the bone. Destruction of the bone is caused by osteoclast. That means osteoclastic activity. Second point, it is also caused due to the viral infections involving the bone cells or severe vitamin deficiencies or mutations. Coming to pathogenesis. In the pathogenesis, we'll see how the osteoclastic activity is increased. It can be 1. Because of the mutations in the sequestrum 1 gene, which increases the osteoclast activity. Or 2, it can be because of the viral infection in the osteoclast precursor cells. For example, if a pregnant mother is suffering from hemophilia or anything, she do not deliver a normal child. Like, the child is also going to have some sort of disease, right? Likewise, this osteoclast precursor cells, when they get infected with any virus, they do not produce the normally functioning osteoclast. They produce some different osteoclast which may have altered vitamin D sensitivity, etc., which also causes bone resorption. So the pathogenesis is because of two things. One is a mutation in the sequestrum gene and another viral infection in the osteoclast forming cells. Coming to morphology, we have 3 stages in it. One is the osteolytic stage, mixed stage, osteosclerotic stage. So in the osteolytic, there will be osteoclast. So whenever there is osteoclast, we see cutting of the bone or the bone resorption. And resorption pits are seen in the bone. It leads to the bone destruction. So in the beside picture, you can see the resorption pits on the bone caused by the osteoclastic activity. The mixed phase, as the name suggests, there will be both osteoclast and the osteoblast. Osteoclast causes resorption, osteoblast causes new bone formation. So this phase is often called as progressive phase to the osteoblast dominance. That indicates the upcoming phase will be of osteoblastic activity. So this is just a progressive phase to that upcoming phase. Coming to the third phase, that is osteosclerotic phase. Here we'll see large number of the osteoblast. Whenever there are osteoblast, that means the building of the bone occurs. But the building of the bone is disorganized, so it leads to the weak and fragile bones susceptible to fracture. The bone here is thick because of the osteoblastic activity, but it is weak and fragile because of the disorganized osteoblastic activity. There will be no structural stability, susceptible to fractures. Hallmark of this stage is mosaic pattern of the lamellar bone or the jigsaw appearance. Before we understand this point, let us see the below picture. In the first phase, osteolytic phase, we can see this blue color osteoclast, which is causing the destruction of the bone. So in the first osteolytic phase, we only see the osteoclast, which causes destruction of the bone. In the second phase, that is mixed phase, we see the osteoclast along with the osteoblast. The bone is destructing, but also new bone is formed. The third phase, that is osteosclerotic phase, we see only osteoblast. That means only the new bone is forming. The bone destruction is stopped in the second phase itself. So the new bone which is formed, you can see it is in the mosaic pattern, right? So the mosaic pattern of the lamellar bone, or is also called as jigsaw appearance. These pictures resemble the new bone formation in osteosclerotic phase. So that's why the hallmark is compared with the mosaic pattern of the lamellar bone or the jigsaw appearance. Clinical features: the patient suffers with the pain or the disoriented legs, frequent fractures, head deformities, etc. Coming to complications. Before we get into the complications, we need to remember this Paget's disease of bone is a benign condition, but it has many complications which can cause malignancy. So these complications can lead to many secondary diseases like secondary osteoarthritis, spinal cord injury. If the bone is growing excessively, it may suppress the spinal cord because of the pressure exerted by the tumor, which can lead to the spinal cord injury. And lion phase, because of the Paget's disease occurring in the skull bones, it leads to a face deformity, which is called as lion phase or the heavy-headed phase. It exerts pressure on the occipital region because of the heavy head. And also it can lead to secondary osteosarcoma, polyostotic disease. These are the complications of Paget's disease of bone. Coming to diagnosis, we can see the x-ray of the bone. The bone will be deformed and the serum alkaline phosphatase increases, but the calcium and the phosphate in the serum are normal. It is a picture of Paget's disease of bone or the osteitis deformans. You can see the disoriented legs. This is the x-ray. And coming to the below picture, it is a head or the heavy head which is exerting pressure on the occipital region. Though the Paget's disease is a benign condition, it has complications associated with many secondary diseases. This is about Paget's disease.